Hi, my name is Natasha Nera, and I am a doctorate occupational therapy student from the University of Florida, completing my capstone at the Norman Fixel Institute for Neurological Diseases in Gainesville, Florida. I'm going to discuss what the rehabilitative profession of occupational therapy is and what our skilled service has to offer for people living with multiple sclerosis. You will also hear two patients share their personal experiences of how occupational therapy service have benefited them. Occupational therapy is a rehabilitative profession focused on helping people maintain as much independence as possible in the things you want to do and need to do. This includes getting dressed, driving, being active in the community, attending religious services, managing your home and work responsibilities, caring for family members, etc. This often starts with having our clients talk through a day in their lives. We ask about what is most important to them and the activities they enjoy, and then consider their circumstances, their routines, their roles, and their goals. Roles can include being a spouse, friend, parent, employee, etc. Goals can include maintaining the ability to independently shower, safety with mobility to avoid falls, managing fatigue, enhancing fitness participation, and much more. With this information, occupational therapy practitioners develop client-centered solutions, strategies, exercises, and tools that fit the context of their clients' lives to maximize performance and participation in various activities. For example, helping an individual experience an MS exasperation, use adaptive equipment or assistive devices to minimize exertion and the need for someone else to assist. Adaptive equipment can include using a reacher to put on pants, a shower seat or handheld shower head to increase safety, a cooling vest to help with enjoying leisure participation, and so on. Occupational therapy practitioners understand that multiple sclerosis can impact every aspect of your life, and that every person's experience with the disease is unique. Multiple sclerosis can even present differently within the same person depending on the day. Occupational therapy practitioners can address a wide variety of symptoms that people may experience and guide you through how to manage your condition and promote quality of life. Let's talk about just a few things that occupational therapy practitioners can address for MS and how. First, fatigue. MS is often called the invisible disease because fatigue, whether it's cognitive, physical, or both, is not easily quantified. Cognitive fatigue can look like having brain fog, difficulty paying attention, and taking longer to process information. Physical fatigue can present like having body aches, physical exhaustion, and slower reflexes. An effective and practical method that occupational therapy practitioners can use to help you manage fatigue is person-centered education on energy conservation. The goal of energy conservation is to reduce how much energy you're spending during activities so that you can complete a task and have enough energy left over to get through the rest of the day. We like to discuss energy conservation in the context of 4 P's: planning, prioritizing, pacing, and positioning. Planning is thinking about or making lists of all the tasks you need or want to complete. Prioritizing is choosing which tasks are most important to get done first. Pacing is making sure you're giving yourself enough time to not rush and allow time for breaks. Positioning is potentially sitting during certain activities instead of standing so that the task is not quite as draining. Another common symptom of MS is changes in thinking and memory, often referred to as cognitive problems or a decline in mental agility. Occupational therapist practitioners design and implement effective and practical compensatory strategies such as writing down lists for appointment, collaborating and creating daily or weekly schedules to help with organization, alarms to help provide reminders, and focusing on single tasking to optimize concentration, attention, and performance. Occupational therapy practitioners can also cognitively challenge you during our therapy sessions with various activities and suggest at-home activities to maintain or improve cognition. Occupational therapy practitioners use clinical reasoning and expertise to suggest the activities that are most beneficial for you, and we can adjust them as needed based on your progress, performance, and needs. We know when and how to make the activities more or less challenging to most constructively work towards your goals. Vision changes can also be a symptom of MS, including decreased contrast sensitivity, which is differentiating between patterns, colors, or objects, eye fatigue, blurriness, double vision, and more. An example of how occupational therapists can address this is by educating on visual fatigue management, as well as introducing tinted lenses or line readers to increase contrast sensitivity and depth perception. We can also assist in maintaining or improving visual perception, which is the way your eyes process information from the environment. We can do this with appropriate activities during our sessions. Occupational therapy practitioners can recommend and make adaptive equipment and assistive technology tools available for you to try. Various equipment and tools can help with typing on the computer, tablet, or phone, getting yourself dressed, buttoning, tying shoes, preparing a meal, writing a letter, paying bills, and many more activities of daily living. These tools can especially be helpful with use and coordination of your hands, also known as fine motor skills and dexterity. This can be impacted by MS. Adaptive equipment that assists with difficulties in fine motor control include adding foam to utensils to make them wider and easier to utilize, rocker knives or adaptive cutting boards to help with cutting food, various types of pens or grips to assist with control when writing, and much more. The goal of utilizing adaptive equipment is to increase participation and performance in the activities you need and want to do. This is by providing you with the right tools that can bridge the gap between what you're having difficulty with and getting the desired activity done. Additionally, occupational therapy practitioners can educate on resources available to you and refer you to other services such as speech pathology, physical therapy, psychology, pelvic floor therapy, urology, and neuro-ophthalmology. These services can provide specialized care for symptomology that may occur in people with MS, such as swallowing, speech production, balance, walking, anxiety, bladder and bowel issues, and vision changes. These services can work as part of the multidisciplinary approach to care for people with MS, and occupational therapy practitioners can help you to navigate this. Occupational therapy is dedicated to being an invaluable resource to you by enhancing confidence, performance, and sustainable participation in every activity and environment that makes people them. OT can help you to live life to your fullest ability by finding ways to promote performance in the things that occupy your time. Our unique and holistic perspective helps us to ask the right questions, to seek understanding, and meet your needs within our scope of practice. Occupational therapy practitioners want you to live a well-rounded, fulfilling life, so it is our mission to help you to do so. Thank you so much for listening so far. Next, you'll hear from 2 patients with MS to share their personal experiences and outcomes with occupational therapy. Enjoy listening from these experts on living life to the fullest despite MS.
Going to occupational therapy has just been a small step in the whole process. You guys have given me a lot of resources that have improved my quality of life.
It has taught me that I can be independent more so than I thought that I could. It really has taught me that I'm still me, I just have to do things differently. The biggest takeaway is that I had no choice with getting MS and being diagnosed with MS, but OT has allowed me to choose to do the things that I still love to do, and I'm not just defined by MS.
I've kind of learned that there's not necessarily one right or wrong way to do things. Even though I can't do things how I used to do them, you guys have showed me that there's other ways to still do it, and tools and equipment that can help me do that. I kind of thought occupational meant occupation, whereas Anthony Garcia kind of taught me that occupational means anything that occupies your time.
I really didn't know what occupational therapy was. After my first initial flare-up and diagnosis with MS, it affected my lower body mainly, and that was an easy fix because I got a chair to get around. But with OT, once I had the second flare-up, it affected my upper body and that functioning, and so then I really started to understand the difference in what OT could do versus PT. It was just a new world that I had never experienced.
Two that helped me function the most would be my adaptive cutting board, and the jar opener. All these pieces of equipment I didn't know existed before occupational therapy. You don't know until you try, you know?
Recently, the OT suggested, based off of information that I gave them, an ergonomic keyboard as well as a rollerball mouse, and it's been a game changer for work. I don't feel as much fatigue. Some of the other tools, as far as hobbies that I love, I was introduced to grip. You slide them onto the utensils in the kitchen. I love to cook, using choppers, gloves so that I don't cut myself. So it really has opened up not only things in my personal life, but it's also helped me to continue to work. Be open to OT, any kind of therapy, be open to it, but be open to OT. There were things during my evaluations that the therapist was able to point out that I had not even noticed.
I would tell them to do their research, and not all occupational therapists are the same. If they're handing you tools that your limbs can't use, find a new one, because there are some out there like you guys at Shands who have just opened up a world of help to me.
When you start to do the things that they tell you to do in OT, you will be amazed that you may not see immediate results, but eventually you will see the results. It's going to be a different timeline for everybody, but you will see it. It will make getting dressed being easier, feeding yourself and cooking easier, household chores, and it will make your entire life better once everything else is easier.
I don't know, you just opened up a whole world for me of opportunity to improve my quality of life.